Welcome to the Joe Cohen Show. Join me as I share my experience with biohacking and invite top health experts to explore the latest technology, supplements, research, and resources for optimizing your body and brain.
There's another time going back to this, how's all this been useful? I was actually able to see when I first got Lyme disease from my smartwatch, and actually it's something called a pulse ox. It measures your blood oxygen. So the story there was we started putting these fitness trackers on people at the time when they were just that, fitness trackers. We realized they're pretty powerful health monitors. This was 10 years ago. And I was wearing one, as were most people we were studying. And wouldn't you know it, the backstory was I was helping my brother put up fences in rural Massachusetts where most ticks are Lyme infested. And then 2 weeks later, I was flying to Norway. And what happened was I noticed on last airline flight that my blood oxygen dropped abnormally low. Your blood oxygen will drop on airlines anyway, but this time it dropped way, way low.
What did it drop to?
It dropped, the median was about 90. Normally it
that's
would be
very
on
low.
on that kind of a jet, it would be normally about 96 at that time. Now it dropped a little lower. Certain flights, it'll drop, certain aircraft like 737s, they're not as well pressurized, so things drop lower. Anyway, on this aircraft, should have been about 96. It dropped to 90, and it never came back to normal. It stayed at 96-ish, even when we were on the ground. So I knew something was off. Didn't have any symptoms yet. I saw my heart rate had jumped up too. And I later learned, I didn't notice at the time, my skin temperature was off from my smartwatch. And so it was all pre-symptomatically. And then I did get a fever off and on. I went to a physician in Norway. I warned him it might be Lyme because of this 2-week period after being in Massachusetts. And he drew blood and
Did you see any tick bites?
I did not. Yeah. So I didn't get a bullseye, which is customary, but not everyone gets one. And so either I don't have much hair, but either was embedded somewhere in the hair I had, or I just didn't get a bullseye.
Were
But
you in
I
the
did,
forest in Massachusetts or in the city?
no, it's a very weedy area though, where again, there are a lot of deers and a lot of ticks. I actually did see a tick that never embedded when I was
You
helping my
saw one
brother.
on you.
I did, yeah, but it wasn't
Okay.
embedded. Yeah. So I
And
know
this
they're
is in
there.
Massachusetts?
Yeah, it was very high grass and such.
Okay, got it.
Yeah.
And this is
Yes.
so it was a high Lyme area with a lot of ticks. You saw a tick on you. I guess I
And then
wanna just differentiate that there's a
yeah.
lot of people that think they have Lyme disease and have never been to a high tick area or saw a tick on themselves.
Yeah, no, some people, we study long COVID a lot. So a lot of people have, get other things that can cause chronic conditions. But going back to my Lyme story, yeah, so he did measure this. He wanted to give me penicillin. I said, no, I need doxycycline, which I took, and it cleared it up right away. When I got back, I did get tested for Lyme. And sure enough, I was Lyme positive with my antibodies and even had some antigens that were there, leftover proteins. And I given blood several days before I left. You can tell I measure myself a lot. And I was negative. So I seroconverted during the time. And it's pretty clear. So it's very well controlled experiment, if you will, that I did get Lyme. And again, it was all caught because of my smartwatch and this pulse ox. So we've now written algorithms where we can tell when people are getting ill in advance of symptoms. And because in my case, I had 2 years of data. We analyzed it, and sure enough, there were 4 times I was ill. The Lyme, 2 viral infections. The 4th time I was asymptomatic, but I had a high marker.
In how long?
Over a 2-year period.
So you were ill 4 times over a 2-year period?
Correct.
Okay.
And every single time we could see my smartwatch, the resting heart rate jumped up in advance of symptoms. So we wrote an algorithm for that. We called it Change a Heart that would detect this. And it worked on me. It worked on, again, we're following this group of people. It worked on 3 other people, one of whom got sick twice. Every single time we could see it jump up a resting heart rate in advance of symptoms. So we
How much
published
of
this
a jump are we talking about?
it varies a bit. So for some people, it'll jump up 15 heartbeats per minute, but for others, it'll be as little as 2 beats per minute. Okay.
Okay.
And we
So
can
how do
still
you know what's noise and what's not?
because it has to go up a certain amount for a certain length of time and a certain maximum signal. So that's how and you can tune the parameter. So basically, yeah, the way we have it set up now, we published this 2017, then along came COVID. And as you might imagine, we worked full blast on it then. And first, we showed we could detect COVID 80% of the time in advance of symptoms. COVID turns out is great for this because there's a long pre-symptomatic period, meaning you don't have symptoms. And we can pick this up 80% of the time with a median of 4 days in advance of symptoms retrospectively.
Oh, wow.
So we have a real-time detection system now that you and all the listeners can sign up for. You go to innovations.stanford.edu/wearables, or somehow you can figure out how to share this or write to me. Anyway, what it does is it tracks your heart rate in a circadian fashion, resting heart rate. And if you have a jump up in signal for too high for too long, it sends a red alert. And it works. So same number 80% of the time. It's not specific for COVID. Any infection will trigger this. We could tell, we picked up even a mycoplasma infection, but other infections do. It also picks up other things, including the number one trigger of red alert is actually workplace stress. So your resting goes up then too. So it's more of a stressor alert, and then you have to sort out what it is. Now, I know if we bring in other data types, it's mostly built on resting heart rate and also built on steps and a little bit of sleep. I know if we bring in respiration and things, we'll be able to distinguish workplace stress from a respiratory viral infection. They're going to give very different signals. We just been
What
harder to
about
get
body temperature?
Yeah. So temperature doesn't work as well. It does, we can bring that in. It worked on me every time I get sick, but I think not everyone holds their watch as tight as they should.
A lot of people with candida overgrowth, they don't really have any symptoms. And so it's not necessarily, like you said, the root cause. For instance, I'll give you an example. I see, let's say you had mold exposure, right? And there's all kinds of different types of mold biotoxins, and they all have slightly different consequences in the body. So for instance, ochratoxin A tends to target the kidneys a little bit more. And so mycophenolic acid, which is a type of a mold biotoxin, it really suppresses the immune system, right? So it's immunosuppressive. So a lot of people with mycophenolic toxins, because of mold exposure, either past or present, they can end up with candida overgrowth or Clostridia overgrowth or whatever other opportunistic organism. You're absolutely right. Candida may not be the root cause. It may be something like a mold exposure or stress. Chronic stress we know that's very typical for suppressing immune function as well. Nutritional deficiencies. We know that folate, for instance, is very important, especially methylated folate for our immune system, because we need folate for cells to divide. And if you have, let's say, a low white blood cell count or low neutrophils, often that can be a folate deficiency. You're right. Like sometimes there's other reasons for the candida, and candida in itself is not the root cause. It had to get the opportunity to overgrow and then become pathogenic. Yeah.
Okay. Yeah, that all makes sense. I think that's what I see as well. What about, so when we're looking at these tests for candida, I guess my question is, or yeast and fungal markers, the question is, what percentage of people do you see are positive for these markers that come to you? Is it like 80%, 20%?
I'd say the arabinose marker, which is number 7, easily 80%. Some it's just marginally elevated by 1 or 2 points. And in those cases, I don't often really bother with it. And then you can sometimes see it in 100. So not every single marker that I see on a test result is necessarily actionable. In fact, I would say with the organic acid test, I may see 20 markers that's abnormal, and I might only focus on 5 markers. And in my experience, when we retest, let's say 4 or 6 months later, all of them have normalized. So often a lot of the markers on here are they will correct themselves if you work on the main things. Like I'll use the nutritional markers as an example. So often with the nutritional markers on the organic acid test, which is these guys here, where they test like for B12 and B6, I often will see deficiencies here, but I don't treat them. So I don't give someone a B2 supplement or a B6 supplement. I focus on the other things that I see there, whether it's toxicity issues or what have you. And then when we retest, all the nutritional markers have normalized because they're either burning through a lot of nutrients because of whatever is going on in their biochemistry, or they're not absorbing them because of gut issues. And so I'd like to work on the main issues, and then all of the other things going to sort themselves out like along the way. But in terms of the candida, yeah, look, I probably see it in about 80% of people. But for some, it's mild and you don't worry about it. And for others, it looks like it could be more problematic.
So what percentage of the people do you think that candida is like a root cause for the people?
We use the word root cause more in the sense of where it can be really problematic and produce symptoms. Then I'd
Yeah.
probably say from the people where I see those markers elevated, maybe 60% of them, it can be quite problematic. And in the other 40, it's not, in my opinion, worth like focusing attention on, because I think there's bigger fish to fry, so to speak.
So is PRP still something you think is like, where does PRP fit in? How does somebody know if they should be doing PRP versus other treatment? I guess that's the best question.
Yeah, and that's a great question, because PRP, platelet-rich plasma, is a very powerful regenerative treatment. It's used in orthopedics, it's used in skincare, and of course in hair restoration for almost 2 decades now. Gosh, you had a PRP and it was painful? That tells us a lot about how that how that treatment was applied to you. And we can go into some great detail why PRP should be applied painlessly. And I'm sorry that happened to you, but PRP, platelet-rich plasma, is the workhorse of regenerative medicine. So you remember years ago, professional athletes used to have, let's say, an injury in their ankle or Achilles tendon or their knee. Many patients like that, many professional athletes like that, flew across the world to places like Germany and France and Italy to get platelet-rich plasma. Why did they do that? Over 20 years ago, we didn't really have orthopedic surgeons that embraced regenerative medicine like we do today. Those kinds of treatments are certainly available now down the block, hopefully at your local orthopedic surgeon's office if you have an injury or trauma to those areas. But let's talk about PRP for hair loss. First of all, it's important for your listeners to know that PRP, platelet-rich plasma, think of it more like a fertilizer into the garden, right? And we're all just scalp farmers here, right? We want to get the best possible regrowth and growth from existing hairs up on the scalp. And so we apply a variety of therapies and treatments in order to do that. PRP is a very powerful treatment, or it can be. But what we've learned over the years is that you have to dial in the correct number or concentration of platelets in order to get the effect. Just backing up for a moment, platelets contain growth factors and other chemical messages that, when released, stimulate wound healing. That's why when you cut yourself with a paper cut or something like that, platelets rush in, clot the blood, start the healing phase. They message the local blood vessels. They message the local fibroblasts to create the healing. They modulate inflammation. So platelets have a big function in tissue regeneration and repair. Many of those same growth factors have a powerful impact on hair follicle cycling. And what we've learned over the past 15 years in the examination of a hair follicle is that it's like, think of it like a car that you want to hot wire. You want to steal a car. You got to know what wires to click together in order to get the engine to turn on and get moving along. And knowing the growth factors now, today, that stimulate hair growth and mitigate hair loss and so forth, we now know platelet-rich plasma contains these growth factors which stimulate the hair follicle directly. So let's talk about the application. Gosh, again, my apologies if you went to a clinic and they applied a painful PRP for you. That's terrible. And that, first of all, it should never happen. Creature comforts and patient comfort here in my office at Bauman Medical is a priority. And the reason why I think it's important, number one, if we apply a painful treatment, I think that you are unlikely to come back. And that's what you insinuated. I don't know if it's worth it, doc. Why should I do this? So if we are able to apply a treatment that works and was comfortable, you'd be more likely to be adherent to that regimen for sure. The other reason is more physiologic. Today, we know that inside the hair follicle, there's actually a stress response pathway, like the HPA axis in our body when we stress and cortisol and so forth, affecting the brain and affecting our body. There's actually those same chemical pathways in each and every follicle. So if you're causing stress at the level of the scalp, you could actually be doing more harm than good. And that's why we want to apply treatments to the scalp in a very careful way. So PRP in the office, we take a small blood sample, we test it in a counter to see what the platelet concentration is. We spin it in a very special way. We use a dual spin process to extract the platelets at high density, so high concentration. We also want to preserve the monocyte population, which is important. So if you went to a clinic like your Medi Spa down the block or some plastic surgeon's office or some untrained hair guy, maybe they use a little test tube with a gel separator or a salad spinner on the desktop or something to separate the blood. That's not going to give you a high concentration of platelets. And it's certainly not going to preserve the monocytes, which are critically important for hair regrowth and for tissue regeneration and repair. So the other thing that's going to happen when you come into the office is we apply a local anesthetic block so it's completely numb before we do anything to your scalp. And we do that in a very special way so that you don't feel the local anesthetic going in. It's a combination of vibration and maybe even some laughing gas, nitrous oxide, things like that, to keep you super comfortable during that process. And then obviously we want to be applying the PRP in the correct area. So if you have a big bald spot, that's not the right place to put the fertilizer in the garden. You have to apply the fertilizer in the garden to the areas that are weak but not dead, and the areas that you want to protect that are not yet weak but are at risk. And some of that is determined by AI-powered microscopes. Some of it's a clinical judgment, but every examination is critical before we even apply a therapy or treatment. So why would you want to do PRP? In my clinic, we've designed a way to apply it only once a year. So you don't need a series of these treatments. You don't have to come in every month or 3 or 4 months in a row. Do it once a year. And we document it time and time again in thousands of patients that on average, a boost will last for about 10 to 14 months before it starts to wear off. And the reason why you'd want to do a PRP, maybe either in conjunction with your current regimen or as a standalone treatment, is that it's non-chemical. So there's no pharmaceutical application daily of medications, either orally or topically, when you're doing PRP, although that might help. You don't have to do any other action. You could use the PRP as a standalone treatment. And of course, everybody could respond differently to that, depending on the hair density and the quality and so forth, and the stage of hair loss. But PRP works better in a younger population, a little bit better, just like it does in orthopedics, where your stem cells can respond better. You can also expect that PRP will work better in the earlier stages of hair loss. So for a lot of our patients who have a busy lifestyle, maybe college students, things like that, or already seeing a receding hairline, getting in the crown, PRP once a year is a great summertime thing. They come in, bada bing, get the treatment done, and we document the results using hair measurement.
So one of the things that can contribute to high heart rate variability is if you actually have a condition that has an erratic heart rate. If you have atrial fibrillation, for instance, then your heart rate variability, your RMSSD could go pretty high. And that may actually be an indication of a bad state of things rather than healthy state of things. So if it's really high, then you have to ask the question whether if it's actually an indication of good health or not. Because the heart rate variability is only useful if you're actually tracking the normal sinus rhythm. Like the SA node, the sinoatrial node, is a pacemaker, I should say, of the heart, and it gets input from both the parasympathetic and the sympathetic nervous system. And so when you are studying your heart rate and heart rate variability, you're assuming that it's the SA node that's driving the heart in terms of the beats, to beat intervals. However, if you have ectopic sites, if you have areas in your atrium or even in the ventricle that's like occasionally putting out signals and then running the heart in terms of the heart rate, then it could cause some elevated heart rhythm like HRV, and that's not necessarily healthy.
Got it. So it could be the outliers. There's some problems there. It's not necessarily healthy.
Yeah, exactly.
And what do we see in terms of overall all-cause mortality for HRV? What numbers would we see as the lowest all-cause mortality?
A lot of these studies were done in the 1980s when they actually assessed. That was at a time when Holter technology, which is a way to record, was just good enough so that a person could potentially measure it and send it home. But a lot of these studies were actually done at spot intervals. Basically, the patient would come in at a particular time of day. They try to control for variables, make sure you're fasting, you're not drinking coffee, you're relatively well hydrated, you're in a seated or supine position. They try to keep it conditioned to control, but it was a spot assessment. So a person would come in for one day and they use that data then to then figure out if that's a prediction for all-cause mortality or cardiovascular mortality in the long run. And I don't know the exact values, but clearly at that time, lower heart rate variability was associated with higher all-cause mortality and cardiovascular mortality. And I think the heart rate variability, a lot of it, what they used was SDNN, standard deviation of NN or intervals. So N actually means a normal rhythm, as opposed to R is just any type of heartbeat. It doesn't matter if it comes from the SA node or even if it's an ectopic beat. So the SDNN makes sure that you're dealing with a normal sinus rhythm, which is what sort of gives you information about the balance between the sympathetic and parasympathetic system. And so what they did at that time was they used SDNN and then looked like one day or even one morning. And then they followed up a year or 2 years after and saw that, yeah, there was a correlation, which is amazing to me, given that since there's so much variability from day to day, that one spot assessment could actually predict for mortality.
Interesting. And besides certain things that I know are very significant for my HRV, like alcohol,
Yeah.
sleep,
Yeah.
stress, how much I exercise, and how much I activate my nervous system as in general, I think. So if I even if it's not exercise, if I go to the sauna, do a cold plunge, exercise, and just super active in the day, my HRV is going to go down just because it's too much. That's
Yeah.
the only things that were super clear to me. Then there's things that kind of help a little bit, but it's hard to say long term. It's not so drastic like alcohol. I drink alcohol, it goes down like 20 points.
Yeah.
It's just very clear. It's
It's
okay.
very
This is
clear.
super clear. Yeah.
Yeah, it's amazing. And for me, probably it's worth just because I've got that Asian flush occasionally. So my heart rate variability goes down significantly. I don't
Right.
respond well to alcohol. Yeah.
Exactly. So besides those things, just general stress reduction, things like that, what else is capable of moving heart rate variability quite significantly?
Yeah. Sleep is important. Your state of mind, obviously, if you're stressed, that's really important. When I get sick with an upper respiratory infection, it's dramatic how much my heart rate variability goes down. And it actually does a pretty good job of telling me when my body is close to recovering.
So my last question is, what are your best sex hacks?
Oh,
Yeah.
sure.
Take me through some of the things that you find
Yeah.
people are having issues
So,
with, and let's just get to, I want to hear all the hacks, the
yeah.
sex
Yeah.
hacks.
Yeah. Yeah. Okay. I would say the first thing that is really important is knowing and understanding yourself sexually. And I think a lot of people never even ask themselves, what turns me on? Right? If you're dating a new person, one of the most fun things you can do is actually, there's like a list of kinks. It's really fun to actually find out, what are you willing to experiment with in the bedroom? What have you done? What have you not done? What do you want to try? Just getting to know yourself. What turns you on? From like the most vanilla fantasies to the most intense things. What is your eroticism? And then I used to be so obsessed with Chia's work, which really did change like my sex life in my early 30s. Montauk Chia is fantastic, but he's a man. And so he's written a lot of his books have been written from a perspective of men. I learned from Saida Desilets that some of the things that I learned about optimizing my pelvic floor can be actually detrimental to women. And so if you overdo the Kegels and you overdo the microcosmic orbit and you only pull in and you don't push out, it's like going to the gym and like you're doing weight training, but you're only focusing on the flexion and not the extension. Anybody who does weight training knows that you're going to get way better results with your fitness if you're actually emphasizing flexion and extension, right? Same thing goes to the pelvic floor. Like I didn't even understand my pelvic floor anatomy, let alone know how to actually create the mind pelvic floor connection. So we have this practice called pelvic floor breathing, which there was a lot of unlearning for me when I had to learn this method because I was so used to Kegels and pulling in my pelvic floor and breathing up my spinal cord with the microcosmic orbit that I didn't really know how to push out my pelvic floor. So when you do pelvic floor breathing, what you're doing is you're literally breathing in. You have two diaphragms in your body. You've got the diaphragm below, that's your actual diaphragm where you breathe.
And you breathe in, your diaphragm expands. And so what you're doing when you're expanding your diaphragm is you're also trying to expand your pelvic floor diaphragm. So your body has this pelvic floor, it's holding in your genitals. And the more that you learn to push out when you're breathing, you're like pushing out, expanding it. You're actually directing energy and blood flow to the pelvic floor. So when you're breathing in, you're actually pushing out your pelvic floor. You're going to pee, but you don't pee. You're not trying to pee. You're just trying to push it out as though you were going to pee. And that what that does is it expands the pelvic floor like a balloon. And that literally moves blood flow and moves energy to that part of your body and creates a brain pelvic floor connection. And your pelvic floor connection is actually where you get your arousal, your engorgement. It's where you get your ability to have stronger orgasms. You have more orgasmic control, you're more ejaculatory control because you actually have a mind pelvic floor relationship. Just like when you're bodybuilding, and let's say you're just going to the gym, you're not getting any results of weightlifting because you actually never learned to use your brain and connect it to your muscle. I don't think a lot of people have ever learned about their pelvic floor and their sexuality as though it's like a fitness thing, right? It's like a fitness practices that you can learn.
If you take vitamin C and vitamin E after you exercise, you counteract those free radicals and your body does not come back as strong. Studies have actually shown that you counteract some of the effects of your exercise by taking C and E post-workout. So that's just to make the point that antioxidants are not a simple story of like always good. There are cases where it could actually have a negative effect for your intended goal. Specifically for NAC, when it comes to longevity, there's mixed results. There are some studies that have shown in simple organisms that it might be able to extend lifespan. But in some other studies, including in mice, it shows that it can potentially shorten lifespan. So I think it's one of those ambiguous cases where we don't know for certain whether it's going to help or hinder. NAC also can increase the metastasis of cancer. So hopefully none of us have cancer. And so for most of us, it doesn't make a difference. Just so, for context, certain B vitamins can increase the metastasis of cancer as well. Once you have cancer, you need to treat your health completely differently when you don't.
Absolutely.
Because when you don't have it, you want to avoid it. And the ingredients that can help you avoid it might actually help to feed or fuel or protect the cancer once you do have it. So there's some complexity there as well. I think, and then when it comes to longevity studies, there was a recent study that found that combining NAC with glycine can lead to higher glutathione levels, and glutathione is associated with better health, especially because the levels of this antioxidant decline as we age. And this is an endogenous antioxidant, which is quite powerful compared to the oral forms of antioxidants, the exogenous forms. So I would say that I personally have mixed feelings about NAC. We have it on our website as an ingredient that we explain as to why we did not include it in the formula. And I explained most of that just now. I wouldn't completely rule it out and say I wouldn't be convinced or willing to be convinced by experimental evidence that it could be good for longevity. But I don't think that there's adequate evidence to conclude that it is good for longevity just yet for these reasons. And if you personally find all of these benefits from it and you're doing this very thorough testing, which the vast majority of people are not doing, then I think you can feel more confidence going in with it than, say, the average person should.
Yeah. So I hear what you're saying. I think as a longevity molecule, I guess if you're just very focused on that, then it's not clear that it's a longevity molecule. But for me, it's more of a health span type of molecule. And like it does help me get my lab markers in the optimal range. For example, GGT, lactate dehydrogenase, homocysteine, mercury. So homocysteine, for example, it's not just an antioxidant also. For example, let's say it actually breaks down homocysteine, irrelevant of the antioxidant status. So I think it does certain things that are not just antioxidant, like it brings down glutamate, for example. That's not based on the antioxidant mechanism. It's based on, and we know that higher glutamic acid in the blood is not good for longevity. What it does is it takes glutamate plus cysteine plus glycine and it creates glutathione. So it sucks up the glutamate. It's one of the best ways to decrease glutamate. I'll use that for protocol for people who I think have high glutamate. What I'm saying, the idea is that there's actually many mechanisms to NAC which are independent of its antioxidant status, and it's not functioning as a typical antioxidant in the way that something like vitamin E may function, or beta carotene or something like
Sure.
that. So I think each antioxidant astaxanthin is also an antioxidant, by the way, right? And we see that
And
has
they all
longevity
behave very
benefits.
differently. Some
They all behave
antioxidants are
differently.
hormetic, right? Some of them are actually
Yep.
pro-oxidant, and then your body upregulates its defenses and you have higher levels of
Correct.
glutathione or superoxide dismutase as a result.
Correct. And I would say there's a similar thing with CoQ10. I'm not sure you're going to live longer, but there was one study that really, like, for people who took CoQ10, their risk of having heart disease just went down dramatically. It's like really good in certain ways. And even after they stopped taking it for a long time, their risk was still lower. So that was a compelling study. And there's other information too. That I didn't notice as much that it's helping my biomarkers, but me, it helped some, but not hard to say exactly. But yeah, I think the takeaway from the conversation, and you helped me better understand your position, is that if something is not necessarily good as a longevity molecule, it doesn't necessarily mean it won't help improve health span.
Right. Health span or specific short-term health markers. And
yeah.
so something that I always want to make sure I clearly distinguish with people is that there are different supplements out there that can have different short-term effects. For example, you might take something for weight loss or for muscle building or for libido or for focus, a nootropic and so on. And they might lead you to that specific goal in the short term. But the question, is it good for you in the long term? And that's where there's a big question mark for a lot of these different interventions. Just because
Absolutely.
you feel better or you achieve the short-term result doesn't mean it's actually good for you to stay on that substance for 5 years, 10 years, 30 years, right? And so we are very careful about choosing ingredients that we have a very high degree of certainty. We're never absolutely positive. That's just the nature of biology. But we have a lot of evidence and are very confident that this is going to be good for you in the long term to extend both health span and lifespan with practically no side effects as a result.
If you're looking towards, you talked about two things. One is the mental arousal type that a person has. Typically, I've noticed probably around 6 different factors that people have in terms of mental arousal. Then if you were to look at quality of touch, there are around like 6 different kind of ways that you can touch. But I think it's interesting to apply not just that touch in terms of with the hands, but then that same type of touch can be applied to like penetration itself. But then you also have the way within which touch is being done. Is it touching that person for your pleasure? Are you touching that person for their pleasure? Are they being touched for their own pleasure? Are they being touched for your pleasure? And all 4 of those things are very different factors. And I think this is one of the things that we will typically notice with, I think you'd asked earlier on, what is it that throws couples off? And a lot of times there seems to be a dynamic where the guy is incorrectly reading his partner and basically going, oh, I'm touching you for your pleasure, but they're doing it in a way that actually is just for their own. And the other person is actually thinking that they're being touched for their pleasure, but what they're doing is just allowing the other person to do it for their pleasure. It becomes this miscommunication and things really go off there because things aren't being read correctly. Because again, not only do we not feel comfortable communicating and speaking what we want, if we even know what that is, but then we also don't embody it, that our body actually is what's expressing it, but our body is also that's what's feeling it. You might not notice, but a lot of women, if you were to ask them what is their biggest turn on, what gives them the most pleasure, they would actually say your response, as opposed to actually feeling their own body.
Yeah.
Because the biggest epidemic, in my opinion, from what I've found and what we've found together, is that it's not actually pain, it's numbness, which shows up psychologically as boredom.
They also found in, I forget which research it was, but 80% of women's female desire is actually based on being desired. So it won't activate until they can feel desire coming toward them. There is a 20% where that's not true, but that's a large amount of the population where if they're not feeling the arousal, the desire for them, then they're not really connected to it. Another part of the answer, which I wanted to give, is that there is any such thing as an erotic fingerprint. And that erotic fingerprint is unique, just like your fingerprint is. Each person has a very particular way in which they respond erotically. The beautiful thing, though, about the erotic fingerprint is it's not permanent like a finger one. It can evolve and be malleable and you can grow. But the original fingerprint is the nuts and bolts of a person. Like you can always go back to that and it's going to be good. And then there's some expansion that goes beyond that.
I think that it may have also been linked with, they call it SIBO, small intestine bacterial overgrowth. Hard to test for that because actually you need to be, when I started getting the stomach pains, I immediately started treating it right away or trying to treat it. But to test for SIBO, you actually need to do a breath test and you need to have not taken any supplements for a few weeks before. It's counterintuitive, like you need to not be treating it in order to even test it. And so I spoke to a gut specialist doctor and they said, hey, usually we don't actually bother to test our clients if they have SIBO or not, because the treatment would be the same regardless to treat gut dysbiosis. And I followed their protocol, which was basically using kind of natural antimicrobial supplements, which actually was shown in different studies. They're shown to have the same effectiveness as antibiotics or prescription antimicrobials. So I thought, okay, I'll try the herbal ones to start. And that was things like clove oil, peppermint oil extract. So I tried a bunch of different protocols, one doctor's for many months, and it didn't really cure it. I tried an extended fast for 7 days, water fasting, and that helped with the symptoms whilst I was fasting. But then when I started eating again, the symptoms just came back. I tried ketogenic diet and then carnivore diet even. And again, these just like helped a little bit, but it didn't cure anything. And so I was suffering again with that for about a year. And then actually, and at some point close to the end of the year, I stopped all the antimicrobial supplements and stuff. And I just had a thought, because you've talked so much about the resistant starch on your Instagram videos and stuff, the Joe resistant starch, and how it had helped you with food sensitivities and things like that. I just started making a daily shake with it. Very few ingredients. 1 scoop of the resistant starch, some frozen strawberries, and some cashew milk, and just blend it. I also put in some collagen sometimes, but don't need to. And blend it, and then had that every day. And I think within about 3 weeks or so of that, I felt that I was not having the same stomach pains. And now I'd continued having it, not religiously every day, but most days. And now I'm at the point where I just went to England on a trip for a week and I was just like, okay, I'm on holiday. I'll be flexible with my diet. And I ate just whatever. I ate something like Persian food, Japanese food, but all, and not caring about the ingredients, carb heavy, etc. And I didn't have any symptoms. And I also just did a gut test on the AWO retreat that we can talk about more after. Yeah. And it's hard to compare because the test I did before was Genova. So I want to do the same test to 100% make sure. But it seems from the gut test, I may now have fixed the dysbiosis. And I'm not having symptoms, and I'm seeming to be able to eat any foods. Whereas before, if I ate some food, I would have even skin outbreak, very skin rashes and stuff. Now all of that seems to have gone away. And so I think, again, hard to place, but it seems from the Joe resistant starch that I've been able to address that.
67% of listeners aren't subscribed to the show, so please don't forget to show your support by hitting the subscribe button now. You'll not only be supporting the show, but also investing in yourself and your health journey, all while helping to keep us ad-free.